A public health crisis overshadowed by another public health crisis. A new study finds that opioid overdoses increased nationally by 29% in 2020. 7 investigator Heather Catallo digs into the Michigan data, finding how the COVID pandemic hurt gains with the opioid epidemic.
In 2019, the state of Michigan was celebrating. Opioid-related overdose deaths had decreased by 13.2% from the year before. But then the pandemic hit.
No doubt opioid-related overdoses have increased.
While 2020 data is still preliminary, in the first half of the year, opioid-related overdose deaths increased by 20%. They rose from 874 in January to June of 2019 to 1,045 during the same period in 2020.
I think it was disheartening to see the increase in overdoses after years of improvement.
The rise in deaths is blamed on isolation, economic uncertainty, and a pause in early access to health care. The pandemic hurt many aspects of normal life, and it also brought new challenges to the state's response to the ongoing opioid crisis.
So when you remove these social supports, along with limited access to certain types of care, it can be devastating.
In June of 2020, the state created a portal to make it easier to distribute naloxone, a drug that blocks the effects of opioids.
That has allowed community organizations to, order in bulk and have that available.
Since then, the state has given out more than 100,000 kits. It has also partnered with Next Naloxone that allows anyone to place an order.
And all of that is free to the community.
While naloxone has played a critical role nationally in reducing overdose deaths, it had shortcomings at the height of the pandemic, when many were alone and therefore using by themselves.
If you're using alone, this can be very dangerous because there's no one there to help you.
Advocates and the state also acknowledge that while naloxone is an amazing resource, it should not be the only solution. Much of the work around the state's opioid crisis has focused on early interventions like decreasing physician reliance on opioid prescriptions.
Really, prescribing for opioids has been on its normal trend, and there's still a long way to go.
Michigan Open is an organization that tries to minimize the opioid epidemic in the state. In 2017, they found that doctors were prescribing 50 to 75% more addictive painkillers than they needed to. Michigan Open co-director Chad Brummett says there is a fear that COVID, specifically long COVID, can hurt that progress.
We certainly know that among people with long-haul COVID, many of them describe pain and fatigue and memory troubles and headaches.
There is a racial disparity as well.
In 2019, the opioid overdose mortality rates among white residents decreased by 16.9%, but increased by 0.7% for Black residents.
It's similar population to those who have been affected by the pandemic and those who have experienced the greatest burden.
The Michigan Department of Health and Human Services plans to launch a new website in the coming months that will allow you to track overdoses in each community. We have more information at WXYZ.com. I'm Heather Catallo, 7 Action News.